Good afternoon. Glad to have you back here for another AMA, Ask Me Anything. I am Tom Dermody, Mayor of the City of LaPorte, and today we've got a packed show. We have Dr. James Leonard that you'll be hearing from later. We'll update you on the COVID situation here in LaPorte County and reminding all of us what we can do to remain safe as we slowly open up our community and our state. But right now, we're fortunate. 2 weeks ago, he made his debut on our AMA, and we're glad to have back U.S. Senator Mike Braun. Mike, welcome, and thanks for coming back.
Hey, good to be on again, Tom.
Well, let's get to it. I know your time is tight. What's happening in Congress, and what are you dealing with these days? And I see a lot of dollars flowing out of Washington into the states.
So we had our weekly conference call among Republican senators. It was between 1 and 2 o'clock, and came in to do this shortly after that. We're going back on Monday. Found out we thought the House was going to do that as well, but they are evidently going to wait a week or so. 435 of them in fairly cramped quarters. But there's a lot we can do as the Senate. We can get back on appointments. It's probably been the thing we've done the most of in a little over a year I've been there. And then there's discussion on what to do, if anything. I mean, we've added basically $3 trillion to the federal debt and put it on the credit card. And most of it, I think, was fairly bipartisan to this point. Now you're starting to get a little bit on these next rounds of discussion. I'm going to be for covering any errors and or omissions, anybody disproportionately hurt that we did not know going into this. Then we're going to have to get back to not only dealing with getting, like we were talking earlier, used to the new normal, but I really think it is so important to get the economy restarted in a smart way. I'm glad to see the governor looks like he's going to begin that after May 1st. We're seeing it across the country. There's so much cabin fever in the sense of people wanting to do something, but it's difficult. We've made progress. We've done a great job here in Indiana. Had the flare up, and you can see how that can happen in Logansport with the meatpacking facility. So no place is immune, but in general, we've done a good job in Indiana. We've had the forewarning and watched all of us with horror what could happen. And if you don't have any advance warning and you don't have the benefit of nipping it in the bud, New York, New Jersey, East Coast. So I think across the country, though, we got to be real careful. We're at a pivot point to where the economy has been hurt worse than I ever imagined it could, especially on Main Street. I'm in my wife's business, same place, did it 2 weeks ago. And of course, there aren't huge crowds in your downtown businesses to begin with. Probably could have gotten by adhering to the principles that you need to do, but not an essential business. So many of them are going to be really anxious and happy to get back to opening and paying attention to the rules, doing two things at once.
Well, one of the main questions I always get is, when am I going to be able to get my hair done or hair cut? So I want you to know, I'm sure you get the same thing.
I do, and all of those basic considerations, I guess you can push down for a while, kick it down the road, but those are all coming into focus, and I feel real good that we can, pay attention to everything we've learned about the disease. It's a peculiar one. It has such tragic consequences for a small, vulnerable part of the population, and I was listening to somebody earlier, the approach that they're using in Sweden, which is they never shut anything down. And we had a few states that did that. I don't know if that was right or not, but I don't think we'll know what was right, really, until you can dispassionately look at this, and debrief it down the road. But we do know certain things work. We do know we need to treat it with respect and care. And I think we can do both. And I think the governor's poised to put a plan into place. I did a couple floor speeches before I left, citing this point in time as being the most difficult, that we're going to get to it sooner or later. And it was talking about doing just that. And I think it'll be county by county within states. I think it'll be state by state across the country.
Well, we're excited. We appreciate all you're doing. I know it had to be a balance with $3 trillion. We know where those dollars are coming from. You'll find them in the future, but you also couldn't just ignore what was happening. So Washington had to do something, and I think you reached out. What are you hearing from small business with this last round of, well, I guess it's the last round that you did to help small business?
So the last round included another $250 billion, also an additional $60 billion earmarked for the smallest of the small. So, and plus, you've heard about some institutions that still qualified at having 500 or fewer. Many of them have been asked to give it back. Several universities fell into that category, several companies, and I think that there'll be further attention paid to that, because this was intended for Main Street and the smallest businesses that didn't have lines of credit, didn't have cash balances. Many of them live out of their businesses. They're run a little differently. So that's the thing about government. It's hard to do it, especially the federal government. And I got to return into being one of the few fiscal conservatives there and talk about how does all this blend in to what we were trying to do before, reform the place, get rid of trillion-dollar deficits that most of my cohorts shrug off as no big deal. We now are going to have debt that we weren't forecast to have until like 2024. So, so far, I've not seen the political will out there where people will make those difficult decisions. So much of our debt is driven by Medicare, Medicaid, Social Security. A lot of what federal politicians, couldn't do that as state legislators. We had accountability. We had a balanced budget amendment. We believed in a rainy day fund. None of those words are even in the dictionary when you're a politician in D.C.
Well, and you see what the state says. We both served what the rainy day fund is, and it's not going to last very long under this difficult situation. So I think we were fortunate that the state just over the years kept that rainy day fund going, and it's going to be an important part of the future here in Indiana.
You bet, and I think other states will realize that after what they've gone through here.
And just as a side note, I would tell you, when you see Illinois asking for some reform and things, I'll personally put my feelings out there that this is not the time to help them reform for bad behavior in the past. So when you guys are looking at states and local governments, personally, don't lift them out of the problems they've created themselves.
No doubt about that, and I don't think there would be any Republican that I know of that would fall for that. And the other thing I'm hearing a lot about that sadly shouldn't be in the discussion is that we'll probably have to do something to protect companies against frivolous lawsuits. That is already being ginned up by places across the country where they're poising to go after companies in a way that could take them from being wobbly to out of business if that would happen. So I think that there'll be some type of protection there so that you don't have that kind of salt in the wound of what we've gone through up to this point.
I do have a couple questions here. What is your position regarding the upcoming primary election regarding COVID-19, and how do we go about voting and keeping voters safe versus supporting mail-in voting?
So I just read something about that here over the last day or so, and it looks like that's going to be compressed into early voting a week before the new primary date of June 2nd. I think it's a difficult thing because you want voting to be as easy as it can, so as many people can get there to vote by mail and early voting. This is again taking where I think we had about the right balance across the state. Now you're going back to where you're compressing it. I don't know that there's any other way that you could do it, keeping in mind what we're trying to do in general about staying out of crowds and so forth. Compressing it though, might create you have to socially distance while you're doing it, and I think that everybody's aware of that. So not ideal, but we need to do it, and we'll get through it.
I know you watch closely with all the universities. You've seen what Purdue, the questions come up a couple times. Mitch Daniels is always going to be a leader, and thoughts on him talking about opening Purdue up back in the fall. And I think once you get past the headline and you see some of the things he's going to be requiring if they do open, it doesn't seem that out of the loop to consider going back on campus for some individuals.
No, I think there, and especially with a guy like Mitch Daniels, that isn't going to throw caution to the wind, but he's also going to be on the leading edge, just like he was 8-9 years ago when he froze tuition. And now he is shaming other places into doing the same thing, and it's because the cost of post-secondary education has gotten way out of hand, and it doesn't often land. Many times you don't get a good job with the degree you've just spent a lot of money on. And I think parents are now especially aware that something needed to be done there with the millennial or two that might be living back in the basement. But in general, I'm going to trust him because I think he does it in a measured way. It doesn't take unmitigated risk. And in life, whatever you do, you've got to take a little measured risk occasionally. And if you do it well, you get through things and you prosper by doing it. Generally, if you avoid it completely, you're in a narrow band, or you're in a probably broad band of mediocrity. And Mitch Daniels has never had a career like that. And I'm glad to see he's out there saying, do it, let's do it safely.
Senator, what about the idea I've heard from a few small business owners that if the dollars go away quick and there's not available for the loans, is this it, or is it going to be a more, let's look at it again down the road and help business, or this is it, this is the last one?
You know, I think it'd be different if we didn't plow $3 trillion in, which you can't get away from that. And it's different, too, in the sense that we're not doing this with a balance sheet that, say, Indiana had relative to what it does and how it performs. Plus, when you hear a discussion about state and local governments as well, you know, there is taxing authority and you've got the ability to raise revenues. And it'd be different again if we were the depository of a huge rainy day fund. We're the depository of a huge debt. And I think that when it comes to businesses, in my mind, ought to be getting used to how you mitigate this risk with your doors open so that you're back gaining revenue, respect it so that we don't have any backsliding on the disease. I think that is a far healthier way to get your business back on its feet than to take another round of government subsidies that we'd have to borrow the money to do that anyway. So I think the time has come where we turn the page, and hopefully businesses, other than maybe the very small ones and sectors that had something peculiar about getting hit hard, the non-essential businesses that have not been able to do anything, maybe giving them some extra help, not ruling any of that out, but I'm looking more towards what we do on our own merit rather than another round of government, because I think that loses its effectiveness quickly.
Well, and I think you'll see something begin opening up this end of this week in the state of Indiana. I think we're all looking forward to hearing what the governor had to say. I know you're short on time here. Senator, what do you have to tell the wonderful people of LaPorte looking out the next couple weeks? What should they expect, and thoughts from your side there?
So I think up to this point, we've done a good job within the state. I'm proud of Hoosiers. We need to realize that until we get a vaccine, until we're finding out how many people really have it out there to where there might be more immunity already among the population, let's get going. Visit your businesses, support them, do it along with the guidelines that we know need to be there until we get a vaccine. But let's look optimistically into the future. Let's look to see how we all individually and by community, move this thing in the right direction. So we're through, I think, the worst part of it, but stay true to what we've learned about it and be optimistic about the future.
Well, Congress gets back May 4th. In the meantime, I think you can check out your website. If people have questions, email. You've got a great staff. They respond. And I've appreciated you always being accessible and available. Keep up the work, and hopefully we'll get you back on when you're out there in D.C. For a quick couple minutes, and you can update us on the craziness out there.
I'll do that. And then once we do get back to where things are more normal, I invited any Hoosier on a Friday, if they want to take a road trip to Jasper, Indiana, you can have up to an hour of my time. And I thought that would only draw folks from right around here. I was booked up 2 and 3 months out, and that offer is still on the table once we get this in our rearview mirror. So keep that in mind.
Hey, we might bring a bus load, and if you're serving dinner, you don't know how many will get there. So
we'll go to the Schnitzelbank restaurant. It's the best German restaurant in the state.
I look forward to it. Senator, be safe. Thanks for your time. U.S. Senator Mike Braun, thank you.
Thank you.
All right, we're going to transition now over to Dr. James Leonard. I think, are we okay to transition? And Dr. Leonard, welcome. I appreciate it. Like I said, this is a packed show, and we are looking forward to get an update. It seems like numbers are coming down. Why don't you take it with it?
Hello,
and,
Mayor.
Update everybody.
Sure, be happy to. Thanks for the invite again. Happy to be here. So yes, overall, cases in the state of Indiana are on a downturn overall. And looking at the curve and looking at the total number of new positives per day, our numbers are going down on a regular basis. That's statewide and definitely countywide. In our county, we are at 199 cases in the county total. Vast majority of that is cases coming out of Westville, where they're doing a good job internally there to keep that contained. And then those cases, only those that require advanced medical care are being transferred out into designated COVID units within the hospitals that are surrounding the facility. Stark County is down. Porter County is down. Marion numbers are showing a downward trend in new positives. Lake County, same scenario. So yeah, overall, it looks like statewide and locally our numbers are decreasing.
That's fantastic. And you just look at Lake, you look at Porter, you look at St. Joe. Is it too simple to say LaPorte people have been doing what's necessary to keep our numbers low?
Yeah, absolutely. Again, if it wasn't for Westville, LaPorte County has done a phenomenal job on distancing and getting to curb the spread of the virus. The county in all did a phenomenal job.
So I had a couple questions, maybe more for Senator Braun, but when do you think we'll have more broad-based testing in Indiana?
That's a good question. Currently, we still don't have much access to the antibody or serology version of testing. We are getting an adequate supply of the PCR test. That's the one that's been currently done through the state and CDC. Our hospital does have good supply, steady supply on supply chain to bring those tests in, and we have what we need to care for our patients. In order to help place them properly into the hospital, if there's any need for screening for surgical procedures and such, we have what we need in that regard.
So PPE, you're doing well. Lack of really patients. I mean, you're not having a lot of COVID patients. So the city of LaPorte seems to be doing extremely well, doing your part, right. Washing your hands, keeping safe.
Yeah, overall, the census in the hospital has been down for good reason. So again, very well done. And because of that, our PPE supply chain is looking good. Our testing supply chain is looking good, steady. We're able to now safely begin to open up to procedures and surgeries.
And then someone said vaccines are not always the answer. Immunity is a better option in their mind.
That remains to be seen. So right now, there's a lot that we still do not understand about exposure, having the infection, and what recovery actually looks like. And that's what these IgG, IgM antibody tests are all about. They test for the presence of antibodies, meaning you have been exposed to the virus. Early on in exposure, your IgM levels rise. Later on, as you develop expectedly a stronger immunity, your IgG levels of antibodies go up. But it's impossible at this point to really be able to correlate a quantitative measure of IgG antibodies to, does that actually mean you are immune? Meaning if you were to get exposed again, would you have any symptoms again? That's too early to tell. You just can't unfortunately, you can't make that direct of a correlation. With number of antibodies present, on a test versus, what does that look like and what does that mean as far as your immunity goes?
Well, and one of the questions here, how can we talk about safely reopening when Cass and Lake counties have recorded the largest single day increases since the pandemic started, and Indiana cases aren't expected to peak for another week or more? And I guess I'll take that on. I mean, LaPorte's numbers are low, and it's a very cautious opening. Whatever happens shouldn't be wide open, and I know you come from a medical perspective, but we still have to take this serious. We're far from being okay. Anything that does open, I think we have to be very careful. And I was just called, one phone call message said, tell the mayor to stop being a germaphobe and open things up. So I almost look at it as there's no win here. No matter what you do, you're going to be wrong. So I think you might as well err on the side of cautiousness.
Yeah, I think when it comes time to, when you're looking at plans to reopen and whether or not that's safe or not, the right thing is to go county by county. Unfortunately, here in LaPorte County, we have done a very good job of that. And so when I look to the hospital and its ability, just within the realm of the hospital operations, when I look, and we have discussions daily about whether or not this is a safe thing to do to open up to surgeries and procedures when the governor said that was an okay thing to do. We have to look at that locally and make sure that that is a safe, that does look like a safe plan. And because of our overall rate of infection within our entire county, and then as measured by our census in the hospital, our PPE, our staffing, and our resources to care for our patients effectively and safely, we do feel confident that procedures and surgeries are safe now. And this will be a week by week look. I mean, we're going to look at these numbers day by day, but when we think about future planning, we'll take it week by week, and we'll do a look back and see if our burn rate on our PPE is still safe and appropriate, our testing, the outcomes of our patients. Are we, by doing these additional procedures, is there any increased risk? Are we going to see our numbers overall within the city of LaPorte begin to rise, or within our patient population, our numbers going to begin to rise? We'll have to reassess all of those things, and that will weigh very heavy on a decision as to what do you open up next.
And so the governor also mentioned, apparently, and it's been here on Facebook, that the armories are going to be testing as well. How are we doing with testing? Is the hospital have enough tests? Do you see being able to get access when you need more? What is the current situation? Because we also have to be, I guess, if you heard over the last couple of weeks, you got to be careful with how much testing is going out.
Yeah, you have to. So currently, we're not in a situation where we can locally within our city or within our county mass test. We can't do population testing at this point. We do have an adequate supply and an incoming supply chain to be able to test our patients that are being admitted to the hospital, those that are looking at that could be higher risk if we're considering need for procedures or surgeries. So just within the realm of the hospital and patient care, our testing supplies are adequate. When the state is releasing additional testing to other entities, like we said in the armories and such, that's a statewide decision on how to allocate out and ration out all these additional tests. So I think it's a prudent thing to do. I would give compliment to the governor on his plan to reopen, again, surgical procedures first. If anyone's going to get it right as far as, or has potential to get it right on curbing the spread of this virus while trying to open up, to first do that within a hospital setting, I think is a smart thing to do. We're going to be as detailed and specific and precise as we can on utilization of proper PPE, containing transmission-based precautions. If hospitals can't get that right, then that's going to be a concern for additional entities, businesses, and so forth.
What about wearing masks? Are you still encouraging? Because we had a question here. Do we finally have concrete symptoms for everyone to be mindful of? And so when you're out in public, wearing masks still something you would support and tell people to do?
I'd absolutely recommend that wearing the mask actually does have to continue. We understand that there's a very high asymptomatic rate, so you could be feeling absolutely fine and feeling you're in perfect health and you're out and about not wearing a mask. Simply talking to someone or being in close proximity to someone, you can still spread the virus. So it is still out there. We haven't developed a herd immunity to this at this point. So if you do just open up and you forego the masks and the contact precautions and the hand hygiene, you will spread that virus, and more folks that catch it will be symptomatic, and they will need advanced medical care. So we have to continue to do all that we have been all of this time. We'll see what the governor has to say about the stay-at-home order. We'll see what that has to, how that goes. But in the meantime, it won't change as far as wearing a mask, washing your hands, covering your cough, distancing yourself as often as you can and should. That's still going to be very important, because it is the same concept as you're going to be able to curb the spread and and picking up that virus if you can maintain those transmission-based precautions still.
What about, is there any data to support isolation, hand washing, social distancing has not only curbed the COVID, but also regular flu? And I mean, I think LaPorte's done a pretty good job, those numbers, but
Right.
how would you answer that from a technical standpoint?
Overall, for given the look back in this year, the numbers regarding annual flu, those are lower than what we usually see on an annual basis, but flu kind of had its peak well before we started to reach our peak here with coronavirus. So flu, for the most part, pretty much came and went outside of the coronavirus uptick and peaking. But of course, as we know, in regards to all infections, or all types of viruses and bacteria that are spread by contact and respiratory droplets, close proximity, by washing hands, by distancing, by covering your cough, we're reducing the spread of all contagious diseases at this time.
It looks like some of my numbers are being questioned, why LaPorte's numbers are low, but is it low due to not having the test available? But I think the test, you could get a test today if you have the symptoms. It's just that not everybody is testing that wants to be tested.
Right. Yeah, far and away, county by county, the far majority of the tests that are being done are done after the identical type of screening process. So the same questions are being asked about risk factors and your symptoms. So that is, I can't say that's 100% of the tests that are being done. I do hear of one-offs, patients that are asymptomatic are being able to be tested here and there. But far and away, the massive majority of the tests being done, county by county, are all patients being selected through an identical screening process of identical questions. So those that screen in are tested, and then you have your total number of positives, and you compare counties that way. So overall, no, I feel very confident saying that our county numbers are large in part due to the success of distancing and all the other precautions.
What do you say about the fact that antibody tests only test for coronavirus antibodies, which there are 60 different strains, which means you have no idea which coronavirus strain the antibodies are for? Getting tough ones today.
These are good. That's a very good question. And the answer to that is it depends. It depends on the manufacturer of the serologic test. That's very true. The FDA has only approved 4 manufacturers to provide this test, and so depending on your manufacturer, you don't know, you can't trust exactly what type of antibody you're testing for. Is it a common annual strain of a typical coronavirus strain? Is it COVID-2, which is coronavirus, COVID-19? That's hard to say. So also then, if you did have a serologic test that tests for the antibodies of COVID-19, and you had that present, just having, like I was saying earlier, the presence of those antibodies doesn't say everything about your immunity. Number one, if you have, if they've got it right on specificity, meaning that IgM or IgG antibody is present when they're looking for COVID-19, if it's that specific, then it's reliable to say that you have been in contact and you were infected with COVID-19. But what that says about your immunity and whether or not you're free to go out and about and not wear a mask and just life back as usual again, it's impossible to say such a thing. We don't know that you can't be reinfected. We don't know that you still can be in a carrier state where you can spread the virus to others. It's very possible you can be reinfected, remain asymptomatic, and if you're not covering your cough, if you're not washing your hands, if you're not maintaining distance where you can and should, it's still very possible you could spread. So again, very good question, and we're learning more and more every day about this. This is something that is very important, and prudent, hopefully in the near future, to come back and say, we have more information on this, and we can be more specific about that.
can we promote building our personal immunity to battle not only the virus, but other airborne illnesses?
That's unknown. If exposure to COVID-19 somehow confers an increased immunity to other viruses, that's not known yet. I've not seen any studies come out that are able to substantiate that.
But you'd highly recommend getting outdoors, keeping to yourself, keeping to your family, but getting outdoors and enjoying the good weather as it's starting to warm up. And, sitting inside is driving some people a little bit crazy. So you guys promote still medically, get out and enjoy the weather.
Yeah, overall staying healthy, it's a balance. It's good social relationships, personal relationships. It's personal health, good sleep, exercise, getting into hobbies. Your point, getting outside, very important to keep your overall mental state of mind in good health as well. There was a question that came through, brought to, I've been asked to address it. Are we seeing an increase in battery and abuse cases since the shelter-in-place order and increase in depression? It absolutely is the case. I would tell you, as far as assessing numbers and such, when to see something coming into the emergency department secondary to depression or abuse, battery, only the worst cases end up in the emergency department. But it is absolutely expected that, unfortunately, the situation is rising. This is becoming more and more prevalent out there. Assume that it is. And we know that there's many folks out there that are battling with this and trying to get through this. And it hits home, it hits everybody. All ages, genders, professions. We have physicians and nurses that are struggling across the board. I don't mean specifically within our own hospital, although it's absolutely possible, but we have mechanisms to support our staff and our physicians. There are mechanisms for you to get help and support as well. I just saw that there's a website, bewellindiana.com. IN.gov just opened up this website. I was going through this earlier today, and it's an excellent website. It provides additional information on where to go to get assistance with mental health, substance abuse, other forms of assistance like healthcare insurance, cash assistance, child care, unemployment, on and on. And this website was put up for this situation to try to help all of us that are affected by COVID-19 and how we get through this and through our lives. So please reach out, please speak up. The hospital is there for you, the police department, fire department. Call your physician, call a friend. Don't go through this alone. None of us can. You're not alone, and you can get help. There are many different ways of going out and reaching out for help. Please do so.
So the other question is medical staff concerned about the extra required steps of documenting COVID-19, whereas they are not required to document other types of medical conditions, meaning the extreme focus and documentation on this particular virus?
So there's a lot of detail and concern about COVID-19, and no physician, no nurse wants to miss such a condition on a patient. So there is a high level of vigilance to recognizing this condition. We're all saying, all bets are off. When a patient gets admitted and they have an underlying medical condition that's unstable, we're still thinking, could this be secondary to or a relationship to COVID-19? So there's a heightened level of awareness and focus and concern to be with a high level of suspicion to go ahead and test and to assess. When it comes to documenting, that there is not much difference in that regard. As physicians and nurse practitioners and PAs, physician assistants, when they're placing their documentation into the medical record regarding a patient's condition, they are looking at systems. What's the heart doing? What's neurologically what's going on? Respiratory-wise, gastroenterology, the psychiatric component. There's a step-by-step system-based approach to all the patient's conditions. And then it's really what we call an assessment and a plan. Overall assessment, system by system, what could be a potential problem list, we call it. And then with that particular problem, what kind of, what is the differential diagnosis, meaning what are all the different types of medical entities that could be causing that problem? We're considering COVID-19 in addition to all the other conditions. There is not a focus all toward COVID-19 and away from all other comorbid conditions or active other underlying medical conditions that could be unstable. So this is just another day at work, another day on the job for a physician, for a provider and nurses when we're thinking about the patient as a whole. We're always assessing our patient as a whole. and what could be going on. So there is all the focus on all the typical medical conditions that we're thinking about and well-trained to recognize and treat, and now it's just adding on COVID-19. COVID-19 does affect several different systems. It can cause what we call multi-organ failure, so we're looking at all systems within the body to understand how stable are all those systems, and could some deterioration be secondary to the virus, and then taking consideration all the literature that's out there now and the research that's out there and best practices on how to treat that condition.
Well, and one thing that's come to mind is that the Retail Responsibility Act, the executive order we put in for the city, where we said 2 people per 1,000 square foot of retail space with all our grocers and other retailers, as well as saying only 1 person per family member would be shopping at a time. That comes to an end May 1st, and we are in the process right now of working with all the retailers, and what we've seen is while they would like to expand the more than 1 person per family shopping at a time, that they will still have controls and safety measures, not only for the safety of the customers, but also for their employees, moving forward as of May 1st. So we're continuing to work through that, but we are talking and speaking with every retailer in the city of LaPorte, and they've been a fantastic partner, but we do see not necessarily extending that, but maybe loosening up the rules. Our council's been very supportive of recognize things that need to happen, and we will see that as May 1st. If you do have questions, you can text me, call me, or follow Tom Dermody LaPorte Mayor Facebook page, or text at 363-7293. And so we're looking through that. Also, our Take 5 initiative, by the way, where people are taking 5 minutes to go clean up LaPorte. If you drive up and down our community, it's starting to make a difference and look fabulous. Jess Bruder, our communications director, giving us a wave behind the scenes here, has put this program together. And if you want that orange LaPorte Proud t-shirt, take 5 minutes and then make sure you email a picture to Jess and Facebook, putting the Take 5 on there. And as well, Beechwood Golf Course. We will have proper protections and social distancing in place, but that opens up May 1st. And NIPSCO is participating in the Arbor Days Foundation Energy Saving Trees program. They'll be giving away 325 free trees to residents. NIPSCO customers can sign up at energysavingtrees.arborday.org. Liz Kaminsky, our tree expert and love of our community, says sign up quickly because they will go fast. And I would think planting trees is a nice, safe, something to do this weekend. So I see we've got a few more questions. The 1 person per family didn't work. I saw families shopping together. Well, again, we can't control what people do if they don't want to follow the rules. We expect people to say, hey, we want to keep everybody safe. And but overall, I think we did make an impact, and our numbers seem to reflect that. Also, do you think, Doctor, and it's probably an unfair question, towards the end of the year, before a person could visit a loved one or friend that's in a hospital or nursing home? Probably too early to tell.
Yeah, I don't know if I put a particular date on it yet, but we do know that we've all got to get on with life, and there is going to be, you talk about this a lot, the new normal. How can we safely get back into life and still maintain the protection that we've afforded ourselves and been successful at in our shelter in place? By sheltering in place, we're not exposing ourselves to one another. That's an alternate form of distancing. But the hygiene piece is important. When you're going out in the community to do your shopping now and do the necessary essential business and travel, we're keeping our infection rates extremely low. So there's absolute success, even though some of us, when necessary, are getting out into the community. So when you think about new normal, we have to find a way as a community, hospitals, businesses, everyone out, going out to the park, going out shopping. How can we continue to distance ourselves enough and contain this virus by maintaining our hygiene well enough so that, and go to restaurants and on without spreading the virus. It can be done. And I think the more resilient and clever we get to come up with ways to do that, yet still be allowed to be able to get out there, it's going to be successful. So once we begin to see and realize that we're going to be successful in putting our toes in the water and getting back out there again, then I think it's going to be very clear that we're going to come into a moment where it's going to be safe to get out there and see our loved ones that are in nursing homes, skilled nursing facilities, any of those folks that are otherwise compromised or in higher risk of getting a severe infection. We just have to be very careful about it. And then there's always going to be ultimately, it comes down to the individuals. If the risk seems too great, don't do it. But I think in the meantime, we'll learn as we go what looks safe. We'll have some track record by that time, and we'll understand how to better give more clear information and advice on that.
Well, and I think the grocery store, even if the rules are loosened a little, that shouldn't be a social gathering place. Get your shopping done. You don't need to bring 3 and 4 children, the whole family, to the grocery store. Get your shopping done as much as possible individually. Take it home. Take advantage of Instacart delivery or curbside pickup, and do the thing simple. But I don't think it's meant, grocery shopping was meant to bring the whole family, and do what you need to do. Get in, get out, and be safe. So let me see if we have anything. Why did this particular virus make the economy shut down, but not the others like the West Nile? That was far worse death rate.
That's because when we saw how contagious it was and how fast it was spreading throughout highly populated areas in the nation, that's the big difference there. There was a lot of attention placed on West Nile. Take Ebola. Ebola was extremely contagious, and its mortality rate was incredibly higher. We were just fortunate as a country in that it got contained, where it didn't start spreading uncontrolled within our country, but we came very close to a situation with the Ebola virus. West Nile is a blood-borne illness, which is a little bit more difficult to spread. Just being in contact with another person that has West Nile, you don't contract it that way. That's spread through mosquitoes primarily. So it's a different way of spread and a little bit more difficult to spread it. So it's less contagious, if you will. Regarding this COVID-19 version of coronavirus, it is extremely contagious, very easily spread, and we had no way of containing it. And then we learned in short order how severe an illness it was causing in such a large percentage of the population in highly populated areas, such that it was inundating the healthcare system, and it just became a horrible situation. Nowhere did we ever see that before, so it became pretty evident pretty quick that it was time to separate everyone out and try to reduce the total infection rate, or slow it down, I should say.
Also, Annette Leffler, our chief of staff, but more importantly, we call her the glue. Everybody has somebody that's the glue that holds everything together, and she is definitely that person for us. Our parks are open, but please stay off the equipment. We can't sanitize it fast enough for the kids that are jumping on and jumping off. So we don't see those things opening up overnight, but the parks are still open. We have fantastic parks. Take the walk, take the family out, and spend that time. So with that, do we have the toll-free number, Doc? Not to put it on you, but I forgot it. Can you give the toll-free number if you have symptoms? Do you want to go through the symptoms again and maybe give this toll-free number?
Sure. So I'll start with the number again. It's 833-576-3627. That's the hotline through the hospital. When you call there, they'll ask you a series of questions, and then they'll process you through and get you set up on a line to get that test if it's indicated at that time. Symptoms, again, are fever. Very common to have a fever. That's 100.4 or greater. But again, we talked last week that if you're feeling warm, if you feel like you have a fever, if you take your temperature and you find it to be 1 or 2 degrees higher than what your normal number is, if you know what that is, your own baseline, consider that to be abnormal and make the call. Very common cough, shortness of breath, general body aches and pains. Sometimes this can begin with a mild sore throat. So pretty much any type of respiratory symptom, like all those that I just mentioned, are very common. Sometimes there's some diarrhea associated with it. Children have more atypical symptoms, like sore throat is more common in children. Diarrhea, small number of cases we present with some vomiting as well. So if you have any concern, if you have a question, you're not certain yourself how to make that decision, go ahead and call the hotline. You'll be contacted or connected with a nurse that's skilled in this, and they'll listen to you, they hear you out, they'll run you through the questions, and they'll give you good advice and good directive on what to do next.
And if you need any information from us, text me 363-7293 or follow Tom Dermody or City of LaPorte Facebook page or call Annette Leffler. She'll be happy I did this, 362-0151. If you do have questions of what's happening in the city. I'd also like to thank Tim Frankie and Duneland Media. If you have as a business, and right now is the time to be putting your business out there, competing for any dollars that might be available, Tim Frankie can move your company forward with his social media strategies and experience that he has. So Tim Frankie, Duneland Media, you can call him direct at 312-316-0980. Duneland Media, he's a local city council person here, been kind enough to do all of this, kind of just giving back to the community, putting us up and available on social media, but he has helped many businesses out there take advantage of it, and your business will do well during this tough time. So we'll update you Friday. On Friday, we have Doka Robbins coming in to talk a little bit about health and wellness as we talk about those frustrations that people may be going through at home, maybe a little stretch, a little mental health. Mike works, so may have to wear the sweatpants coming in here to do some stretches and so forth, but I think it'll be good for you to see what opportunities there are to do at home to keep your mind set to help you get through this. Doc, anything in closing that you'd like to remind everybody of?
Let's continue to stay safe, stay healthy. Please maintain the transmission-based precautions again, the distancing, the hand hygiene, covering your cough, face masks. We'll continue to get through this. We'll begin to open up and as time allows, and we'll take it one day at a time.
Dr. Oz, you better watch out. Doc Leonard's coming for you. Everybody have a great day. Thank you.